Hi, I'm Susan Hendricks, the host of the podcast My Story Living with Lupus. I hold several degrees in the field of health and science, but most importantly, I suffer with several chronic illnesses. One, to be exact, is lupus. My mission today is to open your mind, to get you to think, and hopefully you'll become empowered when it comes to your health care. Did you know that the most serious conditions within the African American community is cardiovascular disease, diabetes, HIV, AIDS, and cancer, breast cancer, prostate cancer, and lung cancer? Now, there is a misconception within the African American community to not be so trustful when it comes to the medical community. Maybe it's because of the previous past of how we have been treated from the medical community. Maybe it's because that the majority of the individuals within urban areas are not educated, don't understand the terms that the doctors use, and doctors don't have the time to explain to the patients exactly what is being stated. That's what I'm here for. You see, I take my 30 plus years in the medical field and my education, and I'm paying it forward to help those who don't understand, who mistrust the medical community, but most importantly, I want to give back and help someone. Do you know that we as African Americans are the most discriminated against within the hospital system? Yes, we are a commodity. And when I say commodity, the healthcare field is a business. And maybe that's why Facebook cut my live off, because in actuality, I'm telling you something that they don't want you to know. We are a commodity. When a doctor, and I'm going to give you an example, when a doctor sells his practice, say this is your chart. Now that file folder, the outside of it, it belongs to the doctor. But that inside information, that is your medical history, belongs to you. You are being sold when the doctor sells his practice and a new doctor comes in. You are being sold when an hospital is bought out by another company, which in turns, if a hospital was a nonprofit hospital, the company that bought that nonprofit hospital turns it into a profit hospital. So that means when you become a profit organization, you're going to be careful about the people you're going to see. You see, there's a misconception in society that the majority of the African American community is on state or government assistance. There is also a misconception that when we are seen in the ER and we're in pain, that we are either drug addicts or we're going to take the script, get it filled from the pharmacy, and we're going to sell it on the streets. So that would make us, how can I put this, street pharmaceutical reps, which we are not. Now, when I was at the doctor's office today, I was getting off the elevator, and I heard someone breathing really heavy. And I turned around and looked, and it was a young lady. She had to have been in her 20s. She was on oxygen. And I thought to myself as I was going to the car, I said, she's overweight. And sure, she could have other medical issues that's happening. And I seen her, while she was sitting there, she was eating a Twinkies, a Hostess Twinkies. And I said, well, that lets me know no one has spoken to her about her weight issue. Now, in my mind, used to be in the medical field, my first thought would be to take that young girl aside and tell her, look, honey, I'm not making fun of your weight. I'm trying to save your life. Start making changes in what you eat. Do you truly understand what they inject into the food that some of us consume? They inject antibiotics that humans take. They inject steroids to make the animals much bigger. So you have to be careful what you put in your body, because if you get sick and you go into the doctor's office and the doctor prescribes an antibiotic and it doesn't work, why don't you think it's working? Because they have injected an antibiotic into that animal, which makes it resistant. So they'll try you on another antibiotic to see if that antibiotic will work. So I'm here to empower you, try to get you to open your minds and start questioning physicians when you go in to see them. It's no harm in saying, I don't know, or I don't understand what you're saying. Just like when I went into my cardiologist's office this morning, and he pulls up the test that was previously performed on me, and he knows that I have a medical background. And so we're sitting up there talking about the test and everything. And so the student doctor that came, that initially seen me first before my cardiologist came in, stood there and looked at me like, I can't believe she understands what he's talking about. And I get a lot of that. Now, I'll sit back and be quiet to see where you're coming from, or see if you're running something on me that I know is incorrect. And then my medical mode will come out and correct you. But I want you to understand that fear of saying, I don't understand what you're saying, doctor. Can you explain it to me in layman terms? This is your life. You're the only one that can say yay or nay. I'm not asking you to be like me. Um, I'm not asking you to do something that I wouldn't do. You may say, well, you're in the medical field. You know what they're talking about. It's easy for you. No, it can be easy for you if you would just make the first move to go forward and start being proactive with your health care. I want you to understand that, and let me give you this example first. I was put in the hospital for my liver. Lupus had attacked my liver, and I think I've told this story before, but for those of you who do not know, lupus attacked my liver. I had just finished my dissertation, and I was in so much pain. I laid on the couch, and I said, well, I'm not going to call an ambulance. I have a doctor's appointment the next morning. I laid on the couch, drove myself to the doctor's office, and he told me, Miss Hendricks, go straight to the emergency room. I'm calling them and telling them that you're coming in. I said, okay. Went to the emergency room and got admitted. Called my sister. I said, come get the car. I said, I've been admitted to the hospital. And while my sister, she came to the hospital, and a student doctor came in. And the student doctor said, Miss Hendricks, you sure you don't use street drugs? My sister looked at me. I said, no, I don't. I said that before. And so the student doctor said, you sure you don't drink alcohol? Because your liver is like a liver of an alcoholic. Now, I'm in pain and I'm in the bed. And so the medical mode in me came out. Then the Madea in me came out. And I had to explain to them, not every black person that comes through the doors of this hospital and is admitted into this hospital is a drug addict, is an alcoholic, or has to lie about who they are. And I told the student doctor, I said, get out of my room. I said, I don't want to see you. You don't know what you're talking about. You're just in training. So you have no idea of what you're talking about. And so they left, and then the regular doctor came in and apologized for what the student doctor had stated. But lo and behold, the student doctor came back in the room and said, Miss Hendricks, you don't remember being seen for this once before? Your liver is totally white, like an alcoholic. And so my sister said, you calling her an alcoholic? And said, I've known her all her life, and she has never taken a drink. And I told my sister, I said, don't say any more. So the doctor told the student doctor, get out, just get out. And so they apologized again. But we are the most discriminated against. And what I need for you to do is to become empowered. Empower yourself. If your next door neighbor needs help, or say for instance comes over to your house and say, well, I've been to the doctor and I don't understand what this says. Can you help me? Become empowered so you can reach out to that person that asked you for help. Yes, I'm doing this. I'm not doing it for myself. I'm doing this. I'm reaching back within my community and helping those who have been forgotten about, who have been mistreated by the medical field, who has been looked at as a drug addict, junkie, crazy, or God knows what else. They are human beings and should be treated with the same respect as you treat someone with Blue Cross Blue Shield. And you may say, I haven't come across it yet. But lo and behold, when you get that wrong doctor in the ER, you'll come across it. So don't think it'll never happen to me. It can happen to you within a blink of an eye. It is our responsibility to help and empower our communities. It is our responsibility, if we have the knowledge, to pass it on. It is our responsibility to be our brother and sister's keeper. Now, you may say that you don't have time for it. You may say it's not your problem. But what I can say is this: you know where you come from, but you don't know where you're going. And it's time for us as a people to start using this. Open your mind. Stay woke. Take your health care seriously. Look, I'm 59 years old. And as my father used to say, and I'm not ashamed to say it, I'm not scared to say it, I'm born to die, but it's what I do in between that makes a difference. I'm not going to leave this world without doing my part and helping my fellow man. Now, over 200 Black people die prematurely every day, in part by a racist society. And the racism extends into the medical field. We are not treated as our counterparts. And if we can get on social media and talk about who did who to this, what celebrity got this, or I got me a pair of new red bottoms, I got me a pair of Jimmy Choos, I got me a new Coach bag or Louis Vuitton. Let me tell you something. When you get sick, can that Louis Vuitton or red bottoms make you well? No, but you can become empowered within yourself to know exactly what's going on with your health. Just like I stated on the podcast, it is important to have copies of your medical records, just in case something happens. A family member can go and say, well, I don't understand the medical language or the jargon within it, but this is what they say that is wrong with her. I have over 900 pages of my medical records and over last count was 590 pages of hospital admission records. Yeah, I have all of that. And I tell my sisters and I tell my brother, anything happened to me, you know, it's medical records in the living room, and I keep medical records in my bedroom. If I should pass out, here's a list of all the medications I'm on. Here's the list of the 39 diagnoses that was given to me. You tell them I have a blood disorder, and that's all you can do. But we have to learn as people, and I'm going to keep saying it till somebody hears me. We have to learn as people to become educated about our medical health. Now, for those of you who sit up and you know that it's something wrong with you and you still eating that pork and you still eating that fried foods and you filling your body with all of that pre-packaged junk that's taking you out even more. Come on, people. Come on. I'm not saying be like me, but start making changes, small changes in what you do. Just think about what I'm telling you. If you don't understand, I wanted to say this. If you don't understand a medical term or a medical diagnosis, get you a Stedman Medical Dictionary. Now, I've had mine ever since I started college, and that's been a long time ago, and I keep it. If my brother calls me and tells me this is what the doctor says, I'm going to screenshot it, and I'm going to send it to you in a text, and I want you to break it down to me. Or my sister Wanda will call me after her doctor's visits and say, Tiny, the doctor says I have such and such diagnosis. What does that mean? And if it's a diagnosis that I'm not familiar with, I'll pull out my Stedman dictionary. But if it's some diagnosis that I'm familiar with, I'll rattle it off to her and tell her you don't have nothing to worry about. You can go on. And she'll say, okay. But my sister Dolores, I have to go with her to every doctor appointment that she has because she doesn't fully understand what they're saying to her. And we have devised a little code. If she doesn't understand something, she'll say a certain word to me. And in turn, I'll tell her what it means. And like I said, and I asked her all the time, why do you want me to go to the doctor with you? Because you're the family medical dictionary. You've been in the field for this period of time, and you know what they're talking about. And I'm not comfortable sitting in there and not understanding what they're saying. So become empowered. Now, you may be saying, well, if your sister's not doing it, why you want me to do it? My sister has me as her walking medical dictionary. She uses me, for things that she does not understand. My sister Wanda does the same thing. My brother Charles will do the same thing. My niece Courtney will do the same thing. My daughter Brittany, even though she's in the medical field, she's more into medical policies and procedures. She writes medical policies and procedures now for a major city, which I can't get into and discuss. But that's her field. And she had me to call her doctor the other day. And she explained to me what was going on. And she said, would you please call them and tell them what I need? And I told her, okay, no problem. And I got what she needed. But yeah, my daughter's understanding is somewhat limited to what I've been used to, because she'll ask me certain things about the medical field. But I'm going to try to do a part 2 of this